Now, data gaps are hindering the planning and provision of mental health services for Africans. The Africa Health and Populations Research Center is concerned that the data gap is leading to solutions that are created without an understanding of the African context.
Mental health challenges are prevalent in low and middle income countries. This means that in Africa, the prevalence rate is really high. But despite this, 98.8% of people with mental health challenges remain untreated. Part of the problem is lack of data, which would inform the planning and provision of mental health treatment.
While a lot of the data and solutions that are present in this context are from high-income countries, only 2% of the data for children and adolescents around mental health comes from the African region. And we know that 75% of mental health disorders lie in low-middle income countries.
Muyingo says technologies such as apps to support people with mental health challenges in Africa are adapted from high-income countries and are not inclusive in addressing challenges unique to the African landscape.
One of the core values for the prize is the fact that we include people from different regions in terms of language, in terms of socioeconomic status, in terms of their access to care. So we are trying to look at an interdisciplinary approach.
Meanwhile, Kenyans have been urged to increase their awareness on cybersecurity in order to protect their data at an individual level. Radiant Software, that deals in systems for financial institutions, says more sensitization needs to be done for the public to understand various cyber frauds and how to protect themselves.
So it's very important for the customers to be aware about the frauds happening in the industry, and so is for the banks and the associations, especially the fintech associations have the responsibility to run the awareness programs about different type of cyber frauds happening, what they shall do, and especially what they shall not do.
Betty Kiptum, Easy Friday.